This conference will now be recorded.
Hello, everyone. This is PSW staff member Erica Martin providing a brief update on some of PSW's innovation work, which aims to create value for PSW members and patients through practice advancement and education. We continue to work on removing barriers to pharmacy-based immunization to expand patient access to vaccines. Wisconsin is very under-immunized and is outside the top 20 states for nearly all vaccines. Low vaccine rates have only been exacerbated by the COVID-19 pandemic. Upon the increase in the pandemic in March, vaccine rates immediately dropped and have remained below the 5-year average. Every age group has been affected. If nothing changes, this could have an effect on herd immunity and lead to outbreaks of vaccine-preventable diseases. In response, PSW has taken action to help pharmacists resume and expand immunization services. PSW has been in contact with the PSW Health Plan Advisory Group to discuss the declining vaccine rates and including pharmacies as a covered location of immunization. Further, a new resource was created by PSW to show insurance coverage of pharmacy-based immunizations by health plans. PSW also has a tip sheet for the administration of curbside immunizations to offer suggestions on the workflow of administering immunizations to patients in their vehicles during the COVID-19 pandemic, as pharmacies continue to operate with closed doors and limited PPE. Moreover, PSW and our partners recently were published for our immunization research. Wisconsin pharmacies administer almost 40% of zoster and 20% of influenza vaccines. However, there is opportunity for pharmacists to play a bigger role in other vaccines. Survey data shows that the top barriers to vaccinating are patients refusing vaccines for financial reasons, patients having insurance coverage for vaccines, and other responsibilities taking precedence over vaccinating. Pharmacists said that knowledge, comfort, storage, and ordering vaccines were not barriers. They also said that they have demand from their patients. You can read more about this research in the international journal Vaccine for free through July 16th. We also continue to work to increase naloxone dispensing throughout Wisconsin. One of our projects is to assess the impacts of a clinical decision support tool at one health system to increase the naloxone prescription. If successful, this tool will be implemented nationally. Early data shows naloxone provisioning was increasing but noticeably dropped upon the emergence of the pandemic. The levels have since rose, and we continue to document the effect of the clinical decision support tool in the coming months. PSW is also facilitating brief academic detailing sessions to increase naloxone dispensing. Faculty members at all 3 schools of pharmacy have been trained in academic detailing and have taught their students how to talk about naloxone on their rotations. If one of your APPE students asks if they can talk about naloxone for a few minutes, give them a chance. They have some great information. We will continue to provide you information on PSW's ever-evolving innovations for pharmacists, technicians, and patients. If you have any questions or comments on what I presented, please feel free to email me. Thank you very much and have a wonderful day.